Rainy, rainy day. All
It
right.
certainly is.
Coordinated care can help us better manage our health, and that's why UI Health is offering highly specialized care all under one roof.
With more than 20 specialties for kids and adults, UI Health's 55th and Pulaski Health Collaborate offers all kinds of care with doctors and nurses from different specialties. Heather and Jobin join us with more. Thank you both so much for being here.
Thanks for having us.
I think, first of all, why don't you tell us about the collaborative and what you do there?
Yes, absolutely. So the collaborative, the 55th and Pulaski Health Collaborative, has been open now for a few years. We received a grant along with our community partners from the state of Illinois to really restore and expand access to health care in a community that really did not have access to a lot of specialty care. So as you mentioned, we have over 20 different health care specialties for adults and children. We offer imaging, testing, mental health, and more. One of our collaborative partners, Friend Health, provides a on-site urgent care there as well. You know, one of the priorities when we came to the community was really we wanted to bring a large amount of complementary services to really serve the whole patient in the community.
And is that what you would say makes it so unique?
Absolutely. We're really excited about what we're doing there. And because of our approach to care, we're looking at the entire patient, right? And so we understand that there are medical needs and then there are needs that affect health that extend beyond the four walls of the clinic. So we're not just providing care to the community, we're engaging with the community. So we have community, we host a number of wellness events, we have cooking classes, mental health workshops, we have a lot of support systems. And you know, what's unique about this clinic is that the comprehensive level of services that we can provide at this clinic, ordinarily you would have to travel outside, you know, of the community to go to maybe a hospital campus. But we've actually tried to remove a lot of those barriers and bring that to the community.
Jobin, talk about some of these services that we're mentioning. There's eye appointments. It's not just urgent care. It's all kinds of services and needs for people.
Yeah, so these are specialty clinics. I mean, you have things from podiatry to orthopedic surgery, wound care, which I practice. You've got endocrinologists, you've got rheumatology, dermatology. I mean, all kinds of specialties. But its main slant is to really feed the community. We have pelvic health care, we have maternity care, everything. And we have social services ready to help on the dime. Like literally, we just call them. They're chasing the patients around, make sure they get to their appointments, make sure they get their medications, whatever we can do to bend and get them to work together.
I imagine if you're a patient who's dealing with more than one condition or one issue at a time, being in a place like this has got to be comforting because you guys are actually coordinating all of that care and sometimes getting patients into a couple appointments in a day.
Right. Yeah, you need to triage those visits too, right? So
right.
Oftentimes we'll share cases with the main campus as well too, kind of making sure that the patients get seen and then specialty things happen in the right place.
I love how you were mentioning, Heather, too, the cooking classes. So these are people who are diagnosed with, say, the high cholesterol or high blood pressure. Not only are they diagnosed, but they come for follow-up treatment and learning how to cook healthy.
Right.
So there's like this part 2 and part 3 of everything that you do, too.
Yes, absolutely. And that's what makes it so special, right? Because, again, it's treating the entire patient.
And when we're talking about the patients, who can get care at 55th and Pulaski?
Our doors are open to everyone, anyone in the city. It's really about what we've done is really change the model. Instead of having patients go to services, we've brought the services to the community. And so that's part of our mission where everyone can seek care there. We want to offer convenient, accessible, high quality, specialized care.
And you said most of these services are free, correct? Most or many?
Our community engagement, our health, wellness, all of that stuff is free. Yeah.
That's awesome.
Beautiful.
Thank
Thank you
you
so much. We
Yeah.
appreciate it,
Wonderful.
and we appreciate the services you're providing in the community. For more information, you can send the QR, or you can scan, the QR code right there on your screen, or visit uihealth.care. You can also find them on Facebook and Instagram.